What are the signs and symptoms of implantation bleeding 3 days before the period?
Hello and welcome. Today, we will be discussing the signs and symptoms of implantation bleeding that may occur 3 days before your expected period. Implantation bleeding is a common phenomenon experienced by some women during early pregnancy. It refers to light spotting or bleeding that occurs when a fertilized egg implants itself into the uterus lining. Let's explore the signs and symptoms to help you better understand what to look out for.
What is implantation bleeding?
Implantation bleeding occurs when a fertilized egg attaches itself to the lining of the uterus. It typically happens about 6 to 12 days after conception and can last for a few hours to a couple of days. The bleeding is usually very light and may appear as pink or brown discharge. Differentiating implantation bleeding from a regular period can be challenging, but there are a few signs to watch out for.
Timing and duration.
Implantation bleeding typically occurs around the time when your period is due or a few days before. If you experience light spotting or bleeding about 3 days before your expected period, it could potentially be a sign of implantation. However, it's important to note that not all women will experience implantation bleeding, and some may not notice it at all. The duration of implantation bleeding is usually shorter compared to a regular period, often lasting only a few hours to a maximum of 2 days.
Color and consistency.
The color and consistency of the bleeding can also provide clues about whether it's implantation bleeding or a regular period. Implantation bleeding is typically light and may appear as pinkish or light brown discharge. It may also have a thinner consistency than menstrual blood. If you notice a few drops of pink or brown discharge 3 days before your period, it could be a potential sign of implantation bleeding.
Other associated symptoms.
While implantation bleeding itself is usually mild and brief, some women may experience other associated symptoms. These symptoms are not exclusive to implantation bleeding and can vary from person to person. Some possible associated symptoms include mild cramping. You may experience mild, lower abdominal cramps that are different from typical menstrual cramps. Breast tenderness. Your breasts may feel more sensitive or tender than usual. Fatigue. You may feel more tired or fatigued than usual. Remember that these symptoms alone are not conclusive evidence of implantation bleeding, as they can also occur due to other factors or normal hormonal fluctuations. If you suspect you might be pregnant, it's advisable to take a pregnancy test or consult with a healthcare professional for further evaluation. In conclusion, implantation bleeding is a light spotting or bleeding that may occur when a fertilized egg implants itself into the uterus lining. If you notice pink or brown discharge 3 days before your expected period, along with other associated symptoms such as mild cramping, breast tenderness, or fatigue, it could potentially be a sign of implantation bleeding. However, it's essential to remember that implantation bleeding is not experienced by all women, and it can be challenging to distinguish from a regular period. If you suspect you might be pregnant, it's always best to take a pregnancy test or consult with a healthcare professional for accurate guidance.